Myself Siddharth Chauhan. Welcome to Easy Medcam. Today's part of the video will be covering about the division of the trigeminal nerve. In the previous section of the videos, we had covered about the trigeminal nerve. We already know that the trigeminal nerve is having a three types of division, which are the ophthalmic division, maxillary division, and mandibular division. There are four types of nuclei which are for the trigeminal nerve. One is for the motor, which is the motor nucleus of the trigeminal nerve, and three are for the sensory, which are the mesencephalic nuclei, principal sensory nuclei, and the spinal nucleus of the trigeminal nerve. In this part of the video, we will be covering about the division of a trigeminal nerve, which are the ophthalmic division, maxillary division, and the mandibular division. So let's start this. The ophthalmic division of the trigeminal nerve, the fibers runs from the face to the pons via superior orbital fissure, and the cutaneous branch will pass via the supraorbital foramen, whereas the maxillary division, the fibers runs from the face to the pons via the foramen rotundum, and the cutaneous branch passes through the infraorbital foramen, whereas the mandibular division, the fibers pass through the foramen ovale, enter the mandible through the mandibular foramen, and the cutaneous branch of this division will pass via the ventral foramen. So in the whole, we have to remember this: the cutaneous branch of the ophthalmic division will pass via the supraorbital foramen, whereas the cutaneous branch of the maxillary division will pass via the infraorbital foramen, and the cutaneous branch of the mandibular division will pass via the mental foramen. And these fibers will enter via the superior orbital fissure, and this via the foramen rotundum, and this division is by the foramen ovale, isn't it? The sensory fibers of this ophthalmic division will innervate the skins of the entire scalp, upper eyelid, nose, from the nasal cavity, mucosa, cornea, and the lacrimal gland, whereas the sensory fibers of the maxillary division will innervate the nasal cavity, mucosa, upper teeth, palate, skin of the cheek, upper lip, lower eyelid, and the general sensory fibers of the mandibular division will innervate the entire anterior tongue, lower teeth. Upper teeth is innervated by the maxillary division, whereas the lower teeth is innervated by the mandibular division of the trigeminal nerve. Skins of the chin, temporal region of the scalp, motor fibers, and the proprioceptive fibers from the muscles of the mastication, isn't it? If we are going to check the integrity of or we are testing whether the ophthalmic division of the trigeminal nerve is functional or not, we are checking for a corneal reflex. So what does the corneal reflex means? The corneal reflex, we are testing or we are touching the cornea with the help of wisp of cotton. It will evoke the reflexive blink. If the blinking is done, or if the eye is blinking, then this ophthalmic division of the trigeminal. If the eye is blinking, this ophthalmic part of a trigeminal nerve is functional. So this is the corneal reflex, whereas the pterygopalatine or the parasympathetic ganglia, which is associated with the maxillary division of the trigeminal nerve, is involved in innervation of the lacrimal gland and the glands of nose and the palate. There are two types of the parasympathetic ganglia which are associated with the mandibular division of the trigeminal nerve. They are the otic ganglia and the submandibular ganglia, which are associated with the division of both concerned with the innervation of the salivary glands, and the motor branches of the mandibular division of the trigeminal nerve will innervate the mylohyoid muscles, the digastric, tensor valli palatini, and the tensor tympani. In this, the digastric muscle, which is the anterior belly of the digastric muscle, is innervated by the mandibular division of the trigeminal nerve, whereas the posterior belly of the digastric muscles is being innervated by the facial nerve. So in this, we have to remember that the anterior belly of the digastric is innervated by the mandibular division. It is not the posterior belly of the digastric muscle which is innervated by the mandibular division of the trigeminal nerve. The posterior belly is innervated by the facial nerve. So that's all for this part of the video. We'll be covering about the remaining section of the cranial nerve in the next part of the videos. So do like, share and subscribe my channel and press bell icon for more notification, and do comments also. Thank you. Please like, share and subscribe Easy Medicam and press bell icon for more notification.